Greetings all. My name is Sonia from Empower School of Health. We will be waiting for next 1 minute because I can see people are still joining. And I'll just give you the brief. First of all, just give me a sec, please. Yeah, so we will be starting this webinar in next 1 minute. I can see our speakers and our moderator for today's session has already joined the webinar. So today's topic for the webinar is the role of leadership and well-trained staff in ensuring steady supply of health products. So as you can see on the screen, we have three speakers for today's webinar. One is Josephine, Ms. Josephine. She is the Operation Director, National Medical Supply Agency. Mr. Mohammed, Supply Chain Specialist, Chemonic, Sierra Leone. Mr. Henry, he's a Director, Central for Leadership Development in Power School of Health, Geneva. And today's moderator is Dr. Amara. He's a National Secretary General, Pharmaceutical Society, Sierra Leone, Supply Chain Professional, UNICEF, Sierra Leone. So I would like to give floor to Amara to please welcome the audience for today's session. Thank you all. Amara, over to you.
Yes. Morning, everyone. Morning, Empower. Henry, nice to see you again. And
nice to see you too.
Yes, greetings anywhere you are from around the world. And we are very much welcome to this webinar on leadership and supply chain management. As we are all aware, supply chain management has increasingly becoming the topic of the day, especially from both within the public and the private sector, to ensure that the timely delivery of commodities, to provide the needed services and to save life in order to bring down mortality and morbidity rates as much as possible as we can. And of course, in the setting where we are in sub-Saharan Africa, we are very much pro the field of supply chain and leadership over the years to actually take us through this topic. So I'm happy and pleased that we have friends and colleagues who are joining from other countries around the world, and you are very much welcome to this webinar. So we'll have 3 speakers in total, as my friend and Sonia already mentioned. 2 of them are Sierra Leone based, and the other one is also joining us from France, and he's working with Empower. Just a quick recap or review in terms of our relationship with Empower. So the Pharmaceutical Society of Sierra Leone, we have an MOU with Empower to provide capacity building opportunities to members of the Pharmaceutical Society of Sierra Leone, and then also by extension to why we're having webinars that are being projected and invited for all around the world to participate. So we have had this agreement for the past 2 years, and we are actually engaging with Empower in a number of areas, such that we are sending our members to participate in the postgraduate diploma program for Empower. And now they have launched the master's program. Sorry, excuse me. They have launched the master's program of the Global Health Procurement and Supply Chain Management, for which we are also continue to engage with them to ensure that our membership also participates in those programs as well. But at some point in time in this webinar, Empower would introduce their courses and speak through to us what is it that they have to offer. So on behalf of the president of the Pharmaceutical Society of Sierra Leone, Dr. Eugene Conte, who is also with us, and the national executive of the society and the general membership of the Pharmaceutical Society of Sierra Leone, I want to welcome you all very much to this webinar today. We hope to move the webinar as fast as possible. So we would move forward to the next slide. Sonia, please. Yeah, so this will be the agenda for the webinar today. As much as also want to squeeze it between 10 a.m. to 11:10 a.m. because of course we have other things that we needed to do and attend to as well. So we have 3 speakers as you may be aware. So we have polls as well where we're able to answer to mind jogging supply chain in very interesting things. And so we also project the poll at the end of the sessions. Please to the next slide. So we wanted to look at some housekeeping announcements, especially for the participants. As you may be aware, we'll be able to to unmute and mute as the case may be, but we want to, as much as possible, keep it very quiet whilst we are in the process. So as much as also keep your mic and video off so we're able to save bandwidth. Please and we'll have the opportunity to ask
I think
our
I
panelists.
request you to please stop your video because your voice is interrupted in between.
Panelists to respond to some of your comments or questions that you have. Please send them into the chat box, and as much as possible, please participate in the poll. So
Amara, you're on mute.
Sorry, I didn't mute myself, but okay. So we have 2 polls for this webinar. Please participate so we know your interest. And also the recordings are being shown live in the Empower School of Health social media platforms. And so as much as possible, continue to engage with us. Please, let's go on to the next slide. So just a few housekeeping for our speakers and also moderator. Please, as if you are not making a presentation, you can turn off your camera to allow for better engagement, and also mute your mic if you're not speaking. So, and finally, we want to ensure that we are together in the timing as much as possible, so we can keep the time as we move forward. Please to the next slide. So as I already mentioned in my introduction, the objective of this webinar basically is to explain and deliver, talk a lot about the role of leadership and a well-trained staff in ensuring steady supply of health products. And as supply chain professionals, we are very much aware of the need, or why we need to have very strong leadership and well-trained staff to ensure that supply chain activities and things are delivered steadily and timely. So these are the things our panelists will take us through, but as much as possible, they will tell us from their own interest and experience what they have gone through specifically in relation to the topic in question. Please to the next slide, Sonia. The poll is being projected. Please respond to the poll as much as possible. So we have a few minutes, maybe 1-2 minutes for us to fill in the polls. Thank you. So
Thank you, Amara. I would request all audience and participants to please participate in this poll. This will be just for a few seconds and it will help us to know our audience for today's session. So please participate and then we will share the results with you also. Thank you. The poll is going very slowly forwarded. So I would request you to please participate. We only have 32% of participation from all the participants. We have over 150 participants for today's webinar. So I would request you all to please participate in this poll. There are very generic questions about you, about your age, basic information about yourself, which will help us to know our audience for today's session in a better way. So accordingly, and as mentioned by Amara, that since we are organizing this webinar in collaboration with Pharmaceutical Society Sierra Leone, and we will be having more session for this year, and that will be posted on our social media. So as we will be knowing your basic details, so it will be easier for us to get the, to decide on the topic that will be upcoming for the upcoming webinars. So kindly participate, and we will be closing.
Yeah, sorry, Sonia, to interrupt. Requesting all the co-hosts kindly do not disturb the poll while it's on your screen.
Yes, co-host has rights to stop the poll. So I would request all co-hosts, speakers, moderators, please do not touch the poll. We are again launching the poll, and now again I request all participants to please participate. The questions are very basic. What is your gender? What is your age? Geographical region are you? It will help us to know from where the audience are coming maximum, from which location. What is your academic background? To know the area of interest of the participants, and also about your occupation, work experience. So very generic and very simple questions. I can see 31% of participants have participated. I request others to please also do so. And then we will close and we will move on to next slides. Yeah, so the poll has been stopped. Amara, if you can briefly share the results, and then we will move forward.
Yes, Sonia, can you please project the results?
Yeah, it's there. Backend team, please, if you can show the results again.
Yes, it's on screen.
I
Okay,
cannot
that's
see it
okay.
from.
I'll take it. So the results for poll 1, what is your gender? We have maximum percentage 69. Those are male. 31% are female. So the maximum audience, they are from age between 30 to 40. That is 54%. So and we have 21% of audience from Sierra Leone, and 23% from West Africa, and 38% from elsewhere. What is your academic background? So maximum 36%, they are from pharmacy bachelor degree. And we have 64% of working professionals, and with the experience of between 6 to 10 years, that is 39%. How did you hear about this? I can see a maximum 73% are from Empower email. Then we have PSSL social media 15%, and rest others. Thank you all for your participation. Now we will be moving forward to the next slide. Over to you, Mara.
Thank you so much. Yes, thank you so much, Sonia. So very interesting poll. So we'll have our second round of poll later in the webinar. So we go now straight into the presentation. So I have the opportunity to introduce the first presenter for this webinar, who will serve as one of the panelists. Her name is Jatu Josephine Abdullahi. She holds the B.Pharm honors from the College of Medicine and Allied Health Sciences, University of Sierra Leone. And she also holds an MSc in Health Supply Chain Management from the University of Rwanda. She holds a master's in Public Health from the University of Sierra Leone, and she worked previously as a hospital pharmacist for Olado and Children's Hospital, and also previously as the head of the Department for Access and Availability in the Directorate of Drugs and Medical Supplies. She's a member of the West African Postgraduate College of Pharmacists, and currently she is the Operations Director for the National Medical Supplies Agencies. So I have the opportunity now to introduce to you Ms. Jatu Abdullahi for the first set of presentation. Jatu, welcome, and over to you.
Thank you very much, Pharmacist. It's a pleasure to be here. Thank you, Empower, for creating this platform that we can share our experience and knowledge with other colleagues. So today I'm very happy to be presenting on this topic of leadership and well-trained staff in ensuring steady supplies of commodity in our supply chain system. And I think it's key for us to look closer at two keywords that I highlighted if you go to the first slide, were well-trained staff and steady supply chains, because we must acknowledge the fact that supply chains can run without well-trained staff, but will we have the steady supply of commodities at healthcare facilities? And we'll kind of see as I go through the slides, what are some of the effects of not having well-trained staff? What are some of the good qualities of leadership that we need in supply chains to ensure we have efficient supply chains? If at any point in time I come in broken, can you please alert me so I can switch off the video and then I'll just do the presentation. Thank you very much. So let's talk a little bit about leadership in supply chain. We first have to set the premise that this is no different than being leaders in other entities. So the same principle applies. There are different leadership skill sets, there are different leadership principles that can be applied in different situations, as the case might be. There are different leadership styles from person to person. There's something that is in us that comes easily in terms of leadership that we can exhibit, and there are skills that you can gain as a leader over a period of time to be able to efficiently manage different supply chains. One of the key things we also have to agree that it is very critical and essential for good leadership to thrive supply chains. So if you have good leadership, it is essential for a successful supply chain. What does a good leader do? A good leader empowers staff. They create the atmosphere of being open to ideas, of sharing ideas with staff, for everyone to understand they are part of a team and their value, their input is good enough to be considered and be absorbed as part of the processes and as part of the decisions, to ensure in our daily execution of routine activities, these ideas are promoted and they are sustained over a period of time. So this is what a good leader does, creating that environment, harnessing the skills, knowing who are the people that make up this organization, and being able to stratify them and know that this person is good in logistics, this other person is good with communications. How within the team that is available to me do I ensure that I know what are the strengths, what are the weaknesses, and how can I build on each of these to at the end of the meeting, the vision and the mission of the organization. Let me pause here and say that leadership should not be seen as a designation at the top. For example, at the Ministry of Health or the health of supply chain institutions. A leader can be found in the different tiers of supply chain, whether it be at district level, at regional level, or at health facilities. These are principles and abilities that can be implemented to guide the way things are done, particularly around supply chains. Most of the time, what we have seen back home is that when it comes to discussion around leadership, it's left for those on top, those at the ministry level, those managing the supply chain. I dare say, I challenge everyone that we are all different leaders where we find ourselves. We set the pace most of the time, should you fall into that situation. So there's leadership and there are management skills as well. And these have differences. Most of the time we tend to mix it up. So for the purpose of this discussion, I will limit it strictly to leadership. And I'm sure that as we go on, we might have the differences between what it means to be a leader and what it means to be a manager. A leader must be able to build the workflows, must be able to see that things are done seamlessly wherever they are operating, and they must be able to sustain this habit or this practice over time. Again, from most of my experience, we are sometimes able to come up with the ideas and to start implementing the ideas. The problem comes with sustaining these ideas, particularly when it comes to input from stakeholders, probably not, for example, like if you have partners bringing in new ideas, new technology, you can be able to implement those ideas and they will for some time continue to work. But then there's so many other factors that depend upon sustaining those ideas that most of the time we fail to address at the nick of the discussion, during the beginning of the discussion. So therefore, we must pay close attention to implementing these ideas and sustaining these ideas over time, building on efficiencies. We must be able to be open to change for improvement. So whatever the ideas are, we must be able to look at the system and say, okay, we can improve on this sector, we can improve in this unit. Most importantly, is the policy environment, the strategic direction that is set by the leader. This is a must because it creates this atmosphere of uniformity and harmonization of how things are done in the different tiers. From research, we have seen that leading entities in supply chain, for example, GSI, they are promoting supply chain entities formed to manage supply chains. Why? Because supply chains are very complex. The need for personnel is so much because we're dealing with different components that we must be able to have supply chains that are managed by skilled staff. A logistician knows what a logistician should do. So a warehouse person knows what a warehouse staff should do for picking and packing, for managing the warehouse, to look at reverse logistics at different parts of the supply chain. So they are promoting, get your own institutions in countries, empower people to be able to learn the skill sets needed to let these organizations thrive. So what we are doing is ensuring that we have people who can continue supply chain activities over a period of time, dedicated just for that aspect. Different components are available in supply chain, and therefore high investments are part of the leadership thoughts that have to flow through organizations. So what does a strong leader do? A good leader ensures that the strong supply chain requires the right personnel in the right quantities, and I stress again, in the right quantities, with right skills, in the right place, and at the right time, to be able to manage commodities over time. Most often, we sometimes have the right personnel, but not in the right quantities. So you will see a lot of burnout. People are tired. You will have the good sets of skills, but that person will be surrounded by people that are not well trained in the same area. So a lot of work is being done by one person, even though it seems as if the chain is full of the number of people that do the work. And I think that is also one of the key things we must learn as well. Next slide, please. Next slide, please. So this picture I found quite interesting because what it's telling you is that as leaders, there is a lot going on. There is a lot going on for one person to be able to handle in supply chain. We must be good with communication. If you can see at the background of that picture, that planes flying, there's ship, there's the stores, there's the vehicles moving, there's a lot of connectivity, there are budgetary issues, there are people issues. You have to be able to communicate with all of these people up the chain and down the chain and keep the communication alive. Supply chain thrives on right communication. So it thrives on information being shared at the right time with the right people, so that when it comes to changing of hands in terms of managing processes, the people are aware that it's now time for us to come on board and take this over, and they know exactly when that will happen. Collaboration. And for me, amongst this is one of the key. Can you please go back to the next slide? I'll quickly finish to the previous slide. Thank you. We want to have seamless collaborations. We want to have strategic links. We want to be able to link with our stakeholders. We want to be able to know the partners with the strength in terms of who makes the highest decisions, who makes the key decisions, who is the budget portfolio holder, to be able to have these links. Which organizations can we partner with to bring value to our institutions? Lastly, change is a big thing. Good leaders should always be open to change, to be able to learn what are the new market trends, what are the logistics technology and the systems that are available out there, to be able to bring together what are ways of sustaining the demand, but also open to bringing new demand, creating new demand and new opportunities for the supply chain entity. I dare say for profit-making organizations, how do you maximize profit? How do you strengthen service delivery at the different levels? So this picture goes for everyone at district level, at facility level, and at central level. Wherever you fall into the supply chain, what is your model of communication? How strong are you with creating seamless collaborations? And how open are you to change? Next slide, please. So I'd like to bring the presentation back home and really talk about our current situation. Most of the time when it comes to staff managing the direct management of health commodities, this list is way longer than this. But for the direct staff managing the commodities, we have two key staff sets. For example, we have the pharmacy professionals and the nurses. And immediately upon completion of their university programs, they are now sent to health facilities to directly handle health commodities. So the issue here is these staff, they're well trained in school to know what the drug does, how to prescribe the drug, how to administer the drug, not necessarily how to manage these drugs in supply chain settings. How do I warehouse it? How do I apply the FIFO principles? How do I ensure I do reverse logistics? It is key for me to give reports, to share reports, to fill my stock cards. Why? Because all of these are tools, all of these are information transferred into data that will be used to resupply the supply chain. So these are some of the issues we face. A lot of our staff managing our supply chains do not have the right skill set to drive the supply chain. And in low resource setting, when it comes to time, when it comes to finances to pour into the activities, it doesn't change. Just because I have a staff in point A that doesn't know how to apply warehousing principles to ensure that the drugs are kept in good condition, to ensure that I rotate my stock so I don't have expiries sitting with me as best as I can, limit or have no expiries at all, because these drugs can actually move. These are transactional commodities. If they do not understand that, it takes the same amount of time for me to distribute the commodities to the last facility. It takes the same amount, the same cost to do the distribution. So cost doesn't necessarily change if you don't have well-trained staff. However, you might see opportunities for efficiencies if you have good staff, well-trained staff, knowing what they must do at every point in time. Next slide, please. Just to make sure I'm still being heard. Amara, can you please confirm?
Yes, I can hear you.
Great. I move on. So what are some of the things that we see when we do not have well-trained staff where they're supposed to be? Again, I'm going to say lack of well-trained staff and inadequate staff when it comes in terms of numbers. I can have a well-trained staff to manage the warehouse, but if that well-trained staff is surrounded by 20, 30 people that we think will do the job and do not have the right skills to perform that task, we can see that one person becomes frustrated, one person is not efficient enough to carry the burden of teaching all of these others, as well as performing routine activities. So we must, first of all, realize that WHO has already said that for the healthcare system to be strengthened, one of the key pillars to look at is skilled health workforce, not just workforce, skilled health workforce. And supply chain staff happen to be healthcare workforce staff. So we must take that into consideration. We see a lot of frequent supply chain breakdowns because there are a lot of inconsistencies. They are not aligned into SOPs. The way a facility does things in point A is different from the way the facility does things in point B, because they do not see the value in aligning the SOPs that state when it comes to this activity, this is how it must be done. They do not see the need for reporting. So that is why we are still struggling with things like reporting rates, although they have improved over time, but not enough to catch up with the current trends. So we are still fighting with filling of stock cards. The stock card is the transactional tool. It tells you the history of the product. The inventory management card tells you what I have used over a period of time, by who and for what reason. So when staff do not understand that I must take certain actions to feed into the supply chain, if they do not understand their space in the supply chain because they are not trained, then it's a big issue, because we're talking about efficiency problems. We're talking about optimization issues. How do we move from one stage to the next if we're struggling with basic things like recording? And these are real issues that, I dare say, are not only peculiar to Sierra Leone, but for most other countries, particularly low-income resource settings. We're dealing with poor inventory management all around. We're talking about stockouts, we're talking about expiries, poor performance. Because why? They do not understand that the actions have consequences. They're not willing to own up because they're not well trained. They do not understand the system. They're not passionate enough to understand that they're a part of the bigger picture. Next slide, please. So I have said a lot of things, and it might seem a little bit depressing, but I come back to you and say there is hope. And what do? We cannot restart and say we're letting go of all those who do not know what to do and we're bringing new staff. It's too big and complex a system. We already have staff in place that can be trained, that we can change the way they think. So let's talk a little more about change management. And for this one, there are many other models that can be used, but one of the ones that I found most easy to explain is the Kotter's 8-step of change management. How can we move from one level to another level? And I dare say for most of us, these are things that we have been doing already in our everyday routine activities, but probably not sustain them over a period of time to get to the last step, and that is institutionalizing these changes that we have made over a period of time. So what do we do first? We create the sense of urgency. We let the people know this is where the issues are. As leaders, and I'm connecting now the leadership with the training of staff, ensuring that you are equipped with the right skill set around you, ensuring that the people you have know what to do to give you the kind of outcome you want. And that is what? To see that you're improving service delivery, to see that as supply chain entities, what is the contribution to service delivery? So you want to create the urgency. There are issues around warehousing. What do? We build the team. Who should do this? We list down the practical steps to take over a period of time that will give us this change that we so need. After that, what do? We look at how to ensure we create an enabling environment. Because you can list down the issues, you can list down steps to take to correct those issues, to shorten that between what makes you successful and what is keeping you down at the moment. But you have to create the environment. You have to make sure the tools are available, the skills are set. Training, this is where training comes into effect. This is where budgetary constraints are addressed by leaders to ensure that they'll be able to generate the short wins. And this is a very key point. You have to be able to know where we were, where you want to get to, and what gets us there periodically. So we have to generate what are the short wins from the 1st of May to the 31st of May. What are the little steps we have taken to change, to improve certain things in the supply chain? And we have to popularize those gains so people have hope that things can change, that we ourselves are certain that we're doing the right thing. It also gives us the opportunity to course correct. Are we on the right path? This is, yes, what has been done in other countries, but is this suitable for Sierra Leone? And I say this with a lot of respect because most of the time we're learning from the country what is happening. We're learning, donors are pushing, learn this, do this. This is what Ghana has done. This is what Nigeria has done. Sierra Leone, take it up and do it. Is it suitable for Sierra Leone? Are we talking about the same parameters? Are we talking about the same data elements? Are we talking about the same geography? Is it suitable for Sierra Leone? Yes, take all the good things I say, but look at what is right for Sierra Leone. And we know we sustain these wins. We accelerate them, we ensure they're replicated. If you are doing a pilot and it works, send it to the other units and do it as well. But then the last part is where most of us cannot keep it. We let it become habit. We let it become part of the change. We put it in the institutions and let that be building blocks for the future. So there is hope in changing the mindset, in changing how we do things. Next slide, please. How do we set the narrative straight? Communication is key. Communication is key. For leaders, we must be able to communicate to the right people at the right time at all the different levels, multi-tiered supply chains. We must be able to communicate with our partners. We must be able to communicate with all other stakeholders. Representation at high levels where decisions are made. Most of the time, this is where we have some of the gaps. And I'm speaking for home, for Sierra Leone. Some of the times what we see is that when these decisions are made at the Ministry of Health level, at the Ministry of Finance level, because supply chain doesn't just deal with health, there are other institutions that affect what we do as well. So these people must understand where we're coming from. They must be able to understand what are the challenges, what are the barriers, because what do we see happening most of the time? There is no drug at facility A, and then a call will be made. Ensure the drugs are taken to facility A. But what they don't understand, there is a quantification process that need resources to be put in to ensure we can be able to better guide what we buy. There is need for procurement. It costs money. There is need to send these commodities to the facilities. It costs money. It costs skills. There are a lot of SOPs developed, but are they using them? So these are some of the things that we must consider at high level when decisions are made around health outcomes. Supply chain discussions must be held at those levels. So we are part of the narrative from day one. It is not a missing link that comes at the end of the day when things go wrong, but part of that decision-making team at different levels, at central level, at district level, and at PhD level. And I keep on stressing this fact because, again, as I said, most times supply chain leadership is seen at top level. Even the level you are at, there is leadership that must be taken into account. Visibility is important for us to know what is the broader perspective of things. How is Sierra Leone fitting into the world? How are our stakeholders thinking? What are their thought process? Who is doing what? Making those strategic relationships, mapping out the stakeholders. And because we have quite a lot of stakeholders, particularly in low resource settings, we find out that we are all struggling for the same resources. So we will have one or two big donors, several NGOs, several other partners, and government institutions struggling for the same pot of funding. And most of the time, this is where enabling environment, policy environment comes in. The policy states that the private sector or the donor world shouldn't necessarily give direct financial support to the ministry agencies that are doing the bulk of the work, that are setting the pace for supply chain activities to be delivered. So what do? You have to work around the system. You have to understand how the system operates. They cannot give money to the Ministry of Health, but they can give money to a partner. How do I strategically link myself to that partner so I am able to harness those resources and at the end of the day, feed it correctly into the need that is there in the public health landscape. I know these are tricky things, and we get sucked up most time in the bureaucracy, but look at the bigger picture. Develop skills to harness the resources around you. Regular assessments, you must be able to get baseline structures. These are our targets. This is where we are at. How do we monitor performance over time? And how do we pay attention to those weak areas and strengthen them? Key importance that I'm going to highlight here is pre-service training. And that is, we do know that when we put people to manage our commodities, we're putting people that do not have the right skills. So what do? We encourage universities to put it as part of their curriculum, that at least when these people come out, they know the basic skills to manage supply chains. They know what is reverse logistics. They know what it means to fill the LMIS tools. They know what it means to report. So they are armed. This is a promising practice because it sets the pace. When these staff come, they know what to do whilst we are training them on the job. Continuous training. Continuous relearning opportunities, be open to new ideas, keep up with modern trends, learn what it takes, the same amount of money to get done, but with more efficiencies. Next slide, please. Next slide. A little bit about competency models for well-trained staff. We must have workforce planning. We must be able to manage their performance appraisals over a period of time. Training schemes, and for this slide, I am going to stress on this point. It is not enough to train the staff as a one-off activity. There must be a scheme in every annual work plan built in for the year. We must be able to train them at different points in times, identify where the gaps are, and create curriculums designed to support those gaps. Career pathway, we must be able to motivate our staff. As a picking and packing officer in the store, is the opportunity for me to grow all the way to leadership. They must see that clear pathway and see themselves as part of the institution, that their voice is heard and they have a place, that their vision will be heard in the organization. Make available the job descriptions, set the SOPs far and wide, let them understand, train them on how to do things. Most of all, professionalize supply chain personnel, because this will strengthen operations. It is not good enough to have a pharmacist, a pharmacy professional, a nurse professional managing stock. They must have supply chain background. They must have supply chain skills, because this is what you need, not how to prescribe, but what to do with the commodity. How do I ensure this commodity reach where it is supposed to reach? They must have those skills. Last slide, please. I want to thank you all so much for having me today to give this presentation. It's very short. So much can be said. There's a lot out there that you can read on how to improve on leadership skills, on how to improve on well-trained skills, collaborate with partners. But lastly, and this is my personal thought that I so believe, and I say it every day as much as I can to my staff. In every organization, the human resources are the most precious resources. We have the ability to make, to break, to sell, to think differently, to enlarge. We have endless capabilities. If you have the human resources right, we drive the processes, not the other way around. It makes all the difference. And therefore, I think today's topic is very much in place, because these are the conversations that must be held around the table for us to decide and see practical changes. We all have been dealing with the same issues. They have not changed, but over the years, we have carried them on and on. These are some of the steps to take to bring that change that we want to see. Focus on human resources, focus on the right leadership skills at the different parts of the supply chain. And I do believe that progress can be made. Thank you so much. Hello.
Yes.
Thank you, Ms.
Yes,
Josephine.
thank you.
Yeah.
Thank you.
Oh, I was
you.
worried there. I just delivered a whole speech and I didn't hear anything back.
Please,
Okay.
we're here. We're still with you, and a lot of comments are coming in how much they appreciate the
Okay.
presentation that you have made. So I want to thank you very much for those thoughtful points you highlighted during your presentations. I think you actually nailed most of the points directly to very key and strategic stakeholders who are supposed to make things happen within the supply chain space. So I want to move straight to so I'll note the comments as they come in. Please, participants, send your comments to the chat box. I will take them from there and I will present them to the panelists during the session for the questions and answer. So we'll move now to the second presenter for this webinar, and I'm happy and pleased to introduce to you a very senior colleague who has a very wide vast experience in supply chain management. He is Mr. Henry Foucault. I hope I pronounce it correctly. I'm sorry if I didn't, because it sounds more French.
Yeah, that's right. Yeah. Thank you very much, Dr. Amara. Sise, thank you for your introduction. It's a pleasure for me.
Yeah, I facilitated a number of trainings and workshops for UN agencies, international NGOs, and he formerly worked as executive secretary for UNECA in Addis Ababa, and also worked at the United Nations headquarters in New York. To introduce to you, my friend, Mr. Henry. Please, over to you, sir.
Thank you very much, Dr. Sise, for your kind introduction. I very much enjoyed listening to Dr. Abdullahi earlier on her speech and presentation about the critical importance of well-trained human resources in support of effective and sustainable supply chains. What I'm going to talk about now is very much related to what we heard already, and is very much on the topic of leadership, but maybe I'll touch on
Mr. Henry, please,
yes?
Dr. Henry, your internet is not quite stable, so if you can end the video so we can hear you more clearly because of the internet.
Okay. All right, so can everyone hear me? So maybe I should, as you say, turn off my video.
Yes, turn off the video, please. Thank you so much.
Okay. So what I'd like to do is to touch, rather briefly, because of time concerns, since we're supposed to, I think, finish in not too long a time, to talk about related areas and focus maybe on the complementary aspects of what leadership is about. So let me start with the screen share, and I want to show you this. It's a point of reflection, leadership versus team leadership. The tendency when we refer to leadership is frequently to talk about or to think of the role of the individual, the characteristics of one person who is expected to act a certain way. The focus increasingly in the field of research around leadership is on team leadership. Why? Because of course, everybody knows that a leader is more than just one person acting, reacting, and doing things. A leader has to work with people and through people. So a lot of work has been done in the last many years on what it means to lead a team, to the extent that we achieve results through people, not on our own as a leader. So it is important to work with people, and to that extent, we can say that leadership skills need to be complemented in addition to, doing making sure that the characteristics of leadership are there, but also it has to be complemented by management skills. So let's explore this a little bit more. What is an effective leader? And again, when we talk about leader here, we are referring to team leadership. In other words, interaction with people. So that calls for a high level of personal integrity. the capacity to set a clear sense of direction, to share, to foster a clear vision of the way forward. I'll pick on a few of those because we don't have time to go through all the details, but I want to pick up on the one that you see a bit on the left side, further down, values differences. In so many cases, the differences that exist within a team can derail the efforts of the team. The differences can be related to educational background, to rank or grade within the organization. It could be gender, it could be personality, it could be national origin or ethnic origin. So this carries a certain baggage with it, those differences. It can translate into maybe some ways of looking at things, assumptions, attitudes, behaviors, expectations. But a good leader, an effective leader, can identify those differences, and rather than looking at those as problems, look at those as value, as opportunities, putting them on the table and creating an environment when those can be discussed, and what each one can bring to the table and has to be factored in. So valuing differences and learning how to work with different backgrounds, and I mentioned just a few, but there are so many others as well, is very much part of effective leadership. So I'm using those as food for thought, and as we continue later on to go about our activities. If you go on the right-hand side column, you can see delegates effectively. Let me pick on this one for a second. So many problems occur in organization because delegation sometimes is plagued with one of two evils, if I may use that expression. One can be micromanagement. So in effect, when one delegates, one continues to micromanage the person to whom we have delegated, and that can be a great source of inefficiency, frustration, and other problems. But at the other end of the spectrum, there's also the reality that sometimes people delegate, but it corresponds to abdication of responsibility. So the question is how to position yourself as the delegator in a way that will achieve success for the work tasked to the team. So again, an effective leader will learn and know how to delegate effectively. So these are just a few examples, but I will end this slide with the last one on the list. An effective leader is humble. Now, that may seem surprising in this list of key attributes of effective leaders, but I'm sure you'll be surprised to know that there's a lot of research being done as we speak on this particular aspect, because a humble leader is one who is willing to admit his or her mistakes, to learn from others, who doesn't come carrying their weight around like they know it all, but is valuing the input, the contributions made by members of the team. And again, we are talking here about team leadership. Let's continue. By contrast, an effective manager is more dealing with strategy, planning, training, monitoring, evaluation, ensuring compliance, managing resources, reporting, and so forth. But the fact is that both sets of skills are different, obviously, and complementary, because it is the same person who has both hats, that of a leader and that of a manager. So a solid supply chain, as we heard from Dr. Cissé earlier, requires effective leaders who are also effective managers. The two go hand in hand. Now, at this stage, I want to share with you briefly a real-life example. I was tasked a few years back with, I was the team leader of a team of supply chain experts. I'm not a supply chain expert, let me state right from the beginning, but I'm a leadership development and change management expert. So in that capacity, I was asked by this big donor organization, to lead a team of supply chain experts in order to assess the maturity level of and to make recommendations when it comes to a particular country in Africa. So that led to a thorough examination of different aspects of the supply chain of that particular country, and then recognizing where what were the key learnings and what recommendations needed to be made. So when it comes to performance management, and this is the slide that you see in front of you, it was found that the performance plans did not fully reflect the scope, the full scope of what was required of employees. And you can imagine that this can be a problem to the extent that how do you monitor performance when the way it is couched at the beginning of the performance year in the plan, the individual plan, is too vague. How do you hold accountable? So if you can see on this slide, they couldn't be used as a basis for ongoing performance discussions and feedback. Why? Because it was general terms. It lacked specificity, and therefore the ratings were problematic. They failed to capture the nuances in performances. So what is the link between this and what we're talking about? To the extent that the team leader manages people within the team, works with and through them, it is important to be in a position to talk about the work of each one individually, to do it in a non-threatening way, in a constructive way, but in a productive way as well. So these are just, this is just food for thought, and to show the link between an effective human resources group of people and the link with getting the job done when it comes to supply chain management. Let me continue. A few other points that were identified, but in particular, if you look at the second point, managers and supervisors were not clear as to the nature of their role and responsibilities when it comes to management and supervision, and that can be a problem. It's important to understand the technical and the non-technical, the so-called hard and soft areas, and what people refer to generally as soft skills are not so soft, because it so happened that lack of those so-called soft skills can have very painful consequences on any organization. So being clear as to what is expected of managers and supervisors is very much at the core of effective management of supply chain. Let's continue. Generally on management issues, a few things had been identified. For example, the capacity of each member of the team to work with stakeholders, to influence, to convince. A supply chain in any country is composed of different groups, the quantification, the forecasting, the storing, the stocking, the distribution, and so forth. So each group is composed of people who interact with other stakeholders at different levels, and it is important to understand and to fully gauge how to go about this, how to influence, to convince, how to work with other people. And that should be part of the performance monitoring at all levels of any given organization within the supply chain. So in this particular case, again, I'm referring to this real life example, it was analyzed and presented to the national and international stakeholders that a sustainable supply chain, in this particular case, needed to pay more attention to clear strategic direction, periodic monitoring, capacity building, focused, measured, and effective management and accountability. The three had to be very thoroughly examined. So, a brief summary of the recommendations. The importance was made, the point that the performance management system, I'm changing names so that the country cannot be recognized, but where they had to be fully aligned with the direction and priorities agreed by the management. The accountability mechanisms had to be very clear, and the performance management system should be used. It was recommended, and then it was implemented actually, should be used as an accountability tool. In the absence of something agreed upon at the beginning of the performance year in writing, not only what the staff member is going to do, but also how they are going to do it, what are the performance indicators, what are the success criteria. In the absence of that, how is it possible to monitor performance? So that's very much part of some of the recommendations made. So when it comes to capacity building, who should be trained? Senior staff, technical staff, in what areas? Technical, non-technical? How many should be trained? What is the objective of each training activity? And what methods would be used? I mean, it should be looked at more as learning. So is it workshop, coaching, developmental assignment, refresher, etc.? When to do so? So all of that has to be analyzed in the context of a mature and well-functioning supply chain. So a few other recommendations, including, as you can see, a mandatory objective for all managers and supervisors regarding their role as supervisors and managers, because again, we are talking about not solo leadership, but team leadership, the ability to work with people and to make sure that the leader is capable of energizing, inspiring, leading, and getting the job done through all the people. So that's all I am going to share at this stage. I would like to identify at the end one major recommendation that was made when it comes to, and that's the link between individual team leadership and institutional leadership. Why? Because leadership can be broken down at several levels. But in this particular case, a senior management team had been recommended, and it was implemented actually, so that there would be a body above that particular organization to oversee the implementation of the general plan. That's how you make sure that the human resources are well managed, and that there's a good capacity at all levels to get the job done. And part of the role of this SMT, senior management team, was to serve as the ultimate accountability tool for the organization, and that can be used at any level in the supply chain. It should be used as a brainstorming, participation in decision-making. It can serve as an advisory, in an advisory capacity to the CEO or the Director General, regardless of the title. Tone setting, strategy setting. So those are a few thoughts I wanted to share with you when it comes to the critical importance of making sure that supply chain management is strongly supported by well-qualified, well-managed, and well-developed human resources. Thank you very much.
Your experiences in this subject matter is very clear from the presentation you just delivered. I'm happy that Empower would be sharing the recording and also the presentations of this webinar later on, so we'll have more time to digest the points that are made, so we can use them in our daily work as we continue to practice in the field of health supply chain. Thank you so much, sir. I'm happy and appreciative that you are able to join and participate. So we would now move to present another colleague, who will be making his presentation on this topic. So he's Mr. Mohamed Bakar Kanu. He's a pharmacy technician by training from the University of Sierra Leone. He also holds a BSc Honors in Information System from the University of Sierra Leone as well. He has an Executive Masters of Business Administration from the University of Jala, Sierra Leone. He's a certified trainer in supply chain, trained by Sanofi and Ministry of Health and Republic of Ghana. So he's also a certified trainer in leadership development by USAID and under the SciHealth program. He's currently a supply chain specialist with Chemonix office, with Chemonix in the Sierra Leone office. So I have the opportunity to welcome and my colleague, Mr. Mohamed Bakar Kanu. Please, over to you for your presentation. Thank you.
Thank you, Dr. Bangali, and thank you to all the organizers. Good morning, good afternoon, and good evening from wherever you are. Next slide, please. So I'm going to make my contribution. Really, I'm really happy to be here to make a contribution on the role of leadership and being well trained in ensuring a steady supply of health commodities. Of course, so as a supply chain leader, you are expected to, next slide, please. As a supply chain leader, you are expected to mobilize orders. You plan your resources and use them effectively. Of course, my discussion is not going to be based on academic discussions, but I'm going to base my discussions on real life supply chain leadership goals and their training in ensuring we have a steady supply chain. Of course, I may want to say a lot has happened in terms of building capacities of leaders. I could remember way back in 2017, wherein we have the first leadership development training supported by CIPes. And most of the participants from that training today are at the helm of affairs in terms of supply chain, either from the top leadership or middle level leadership. Of course, a lot has happened. Just recently, we got a training after the revision of the Integrated Logistics SOP manual, wherein colleagues participated. I happen to be one of the co-facilitators. Of course, when it started, it was really like a fun, saying we are going to do this course with ease and so on and so forth. But interestingly, it goes on until a point wherein colleagues realize that, oh, managing supplies is not just a fun. Because as it stands, for us to have a continuous flow of supplies, one has to master the Integrated Logistics SOP manual that shows how products are to be managed effectively. The LMIS tools, we need to understand them because they are the basis that gives the information that guides decision. So during this training, we started with about 43 participants, wherein at some point, we have a session of capacity development. It involves the logistics tools, the management roles and responsibilities. And at some point, there was a mock test, because it was clearly stated that for you to be a leader that is going to cascade trainings to the lower level, you have to be certified and you must master the skills in terms of capacity as well as facilitation skills. From the mock test, people realize that, oh, am I fit? Should I relax, or should I put more effort to ensure that I cope up and I'll be able to get my certification? People stood throughout the night to study to make sure that they catch up with the actual competency test. Indeed, at the end of the day, out of 43, 37 people were able to be certified as trainers. So what I'm trying to say here is, one should not be complacent. You have to be always be on top of situation. Read, continuously practice. Next slide, please. So, since 2017, I want to give a real life example of myself. I was part of the 2017 training. In that particular training, I got the inspiration to lead and to support colleagues. In my initial workplace, the Ministry of Health, and I'm as a information system specialist, I was more passionate on improving reporting rate, because in most cases, when we go for meetings, we are always being cried down that we are always down in terms of reporting rate. So this prompted me to see how I can bring in others to improve. I bring in colleagues, staff members, I involve other partners as well to support in this drive in ensuring that we improve our supply, the LMIS reporting rate. It started at something like 40%, and now we can boast of 80% and above. And with support from colleagues and partners over the years, we have been able to capacitate our colleagues to be able to use data to make informed decisions. Previously, the distribution matrices were made based on the size of the facility, one size fits all. Facilities were visited for supervision based on just thoughts, say, okay, I want to visit this facility. It was not based on informed decision. But today, colleagues at different levels, especially at the district level, that are interfacing with the facilities, knows how to analyze data, extract and analyze data, and make decisions on which facility to visit based on the quality of the data. Next slide, please. I copied this model from one of the materials shared during the leadership development training, and I learned a lot from this. Because if you fail to incorporate these leading, managing, and governance skills into your daily work, it will be very, very difficult for you to improve the overall health system performance, because ensuring products at facility level is one of the drivers for overall system health performance. Of course, like so leading, managing, and governing should be together, should be in one basket when you are looking yourself as being a leader. And also make sure that when you are leading, you should be a role model wherein colleagues can learn from you. Next slide, please. So let's just have a quick reflection on the leadership values, which I think we need to put more emphasis on. Integrity and commitment. Of course, people are trained. They have all the qualities, all the capacities in terms of leadership as well as management, but putting integrity and commitment into the work might be lacking, which I think we must put all our efforts on for us to improve on the flow of health products. Respect and trust. We should learn to respect our colleagues, our workmates, our subordinates, and trust them for us to improve and to make sure that we have a sustained flow of health products. We should have the courage to take risks. And overall, we should have the courage to learn continuously. Next slide, please. So my last take here is we have institutions that are providing supply chain courses. We have colleagues in country who have a lot of experience in terms of leadership, in terms of management, in terms of supply chain. We should be in position to learn from them. One should not feel big that, oh, I have a PhD, I should not learn from the lower level personnel. Some who are at middle level or lower level have a lot of experience in terms of leading and managing. So you must be in position to learn from them. So thank you for joining us, and over.
Thank you so much, Mr. Kanu. Thank you very much for your time and your presentation. And I think altogether, all the three presentations has provided different perspective within the same topic of interest. So I have a few comments. I note, I think one or two, but we'll do that during the question and answer session. But to move the program forward, I'll ask Sonia to present on behalf of Empower with the next slide. Sonia, please.
Thank you, Amara. And I really would like to thank all of the speakers for their time and for their their presentation, and we're hopeful that it will be helpful for the participants. Now I'll just move on and I'll just give you a brief information about the courses that Empower offers. And if you think that any of the course is of your interest, then please get connected with us. We have master's course, as you can see on the slides, and for masters we have two categories. That is, one is for 12-month course, another one is for 24-month course. Then postgraduate diploma in global health procurement and supply chain management. This is also for 12-month course, and 6-month diploma, and we have many other short courses. The language that is available in English and French. And for more information, I would request you to please visit our website, and the link is posted on the chat, so you can check our website and you will be having more information about the courses that we offer. Since we are organizing this webinar in collaboration with Pharmaceutical Society Sierra Leone, and this is not the only session that we will be organizing. There will be more coming in next month, and that will be posted on the social media. So I would request you to please follow our pages for our social media page to know more information about the upcoming webinars and seminars. So this will be the announcement of master course that is for 12-month and 24-month as explained to you in the last slide. As you can see the fee structure, this is the initial fees or original fee for the course. For 24-month masters, the original fee is 8,000 USD, that is exclusive of taxes and bank charges. 12-month master's course, this is specifically designed for PGD graduates from Empower School of Health, and the fee for PGD course is 2,500 USD. So since you are our participants for today's session, so we have special partial scholarship that is available with us. So I would request you to please get connected with us. The email ID is mentioned on the next slides, where you can reach us at operations@empowerschoolofhealth.org. And also for PSSL members, you can get connected with PSSL or Dr. Amara. The link for all of our courses is mentioned on the bottom of the slides, and this slide will be shared with you all within 24 to 48 hours post webinar. Now this is the time to launch poll 2. We don't have much time, so we will be taking very important questions. Amara, please take the questions, and those will be addressed during the Q&A session. Thank you. I would request my backing team to please launch poll 2. And if you have specific questions related to the course enrollment process, please write us at operations@empowerschoolofhealth.org, or you can visit our website for our contact information. Thank you so much. Attendees, please participate in this poll. This is the last poll, and it will be helpful for us because there are some important questions as in your area of interest topics, the courses you might be interested in, and it will help us out to know what is your requirement so we can build something in near future. Thank you so much. %43 of attendees has participated in this poll. I would request others to please also participate. And this poll will be closed in few seconds, and then we will launch the results. Amara, please, I would request you to please take further for sharing the results with the attendees.
Sure, I will. Please participate in the poll. We will share the results shortly. Thank you.
Also, I can see people are asking about the slide deck, the recording. Yes, the slide deck and recording will be shared with all. And also, you all will receive the certificate of participation. The link will be posted on the chat box. I would request you all to fill up your form, then only it will be sent to your registered email ID. So please mention your details correct over there, and that will be used or provided in the certificate that will be sent to your registered email ID.
So I think we can end the poll now and present results. Sonia, can you please?
Yes, please backend team stop the poll and share the results. Yeah, it's been stopped, Amara. You can take.
Okay, yeah, no problem. So we have 149 people that participated, which account for 65%. When asked if the information is useful or not, 98, all of them said yes, it is useful, and just a few said somehow useful. So what would you like to receive more information on regarding this topic? So 10% said they will need to receive more information on HR for health, and 77 said on supply chain, global surgery said 3%, and any other said 9%. Are you interested in working in HR for health? 13% in supply chain, 82%, and 5% in other areas. So you see that most of the participants have very keen interest in supply chain things. So are you interested in enrolling in supply chain courses? Yes, 91% said yes, they are interested, and 9% probably because they are already completed supply chain courses mentioned no. So if your answer to this question was yes, please follow the instructions already delivered by Sonia, so you can be able to participate in the Empower courses. If you are a member of PSSL, please do not hesitate to contact us or me more directly. So which topic or courses are you interested? So which topic was I interested in? Digital health, 6%, global health, 13%, emergency response, 7%, and leadership, 13%. I mean, I think we're having a very good mix of the specialty areas within supply chain management. So thank you, and please let's go to the next slide, please. Yes, so welcome again to the question and answer session. And during the presentations by the panelists, most of the thoughts that were put in the chat box were basically comments to either buttress or emphasize on a specific points that the presenters were mentioning during their presentation. So, and I also ask that the presenters also make time to go through the comments in the chat box, because most of them are in support of what they have said during their presentations. But there is one comment that I picked out from the chat box, which I think it's a question. It came from Sia Bobo, and she said supply chain modules. She said Jatu mentioned that supply chain modules are already in universities where pharmacies and pharmacies-related courses are being provided with supply chain modules. So she wanted to know which universities have started providing these modules to their students. So that was for Ms. Jatu Abdullahi. I don't know if she's online. She can quickly take this one because this is the only comment that I was able to note from the chat box. Jatu? Okay. Okay, so if we cannot get her, can we? Well, I think most of the universities in Africa, to be more specific, are providing supply chain courses. Some, even though not part of the pharmacy curriculum, but also as a sub module, probably at postgraduate level or as a certificate or diploma level, but also they have started embedding, for what I know in theory, they have started embedding some basics in logistics management information system into the courses for the nursing schools. Yeah, so that will help them to see how they can manage products at any level that they are posted. And for other universities, for higher courses like degree and so there are also other institutions that are providing supply chain modules as necessary. So I think that is what I know, which I can provide answers to. The link for the certificate is being posted in the chat box. Please click on the link and access your certificates. I will ask Sonia to please leave the Zoom platform open for at least 15-20 minutes, so more people will be able to access the link for the certificate and they can access their certificates. Sonia, any final thoughts?
No, that's all, Amara. I think we are already 30 minutes over time. So I would really thankful for all speakers, as I mentioned earlier, and also for all attendees for their participation. And yes, the link will be live for some time, so you can fill up your form to receive the certificate, and the certificate will be sent to you within 24 to 48 hours. That's all. Thank you. Thank you, Amara, for your support.
Yes, thank you so much, Sonia, and thank you to Empower. Thank you to Mr. Henry, Jatu, and Mohammed for their agreement in participating as panelists to these webinar sessions. So we will also continue to engage with Empower for more webinar sessions during the course of the year. I want to thank all my friends and colleagues that participated from outside of Sierra Leone, especially those that we have very different time zone, for making sure that they are able to participate in this webinar. I want to thank you very much for that. It's not because you love Sierra Leone, but probably because you wanted to learn more about supply chain management and supply chain systems generally. So I thank you so much for that. So on behalf of the president of the Pharmaceutical Society, Dr. Jim Conte, the national executive, and the entire membership of the Pharmaceutical Society, I want to thank each and every one of you for joining and participating in this webinar. Thank you very much. So it's the link will be, the Zoom platform will remain open for the next 15-20 minutes, so you can get your certificates. Thank you all, everyone. See you, speak to you next time. Bye-bye.